I am about 7 months out from my amputation surgery, and this here little nubbin has been giving us some issues. So there's a nerve like right here that runs all the way down to your ankle, and that is a nerve that was severed in the amputation surgery, obviously, but it's also, I think it's called the Saphenous nerve, and that is the nerve that has been causing so many issues with phantom pain and with trying to even wear my prosthetic. I mean, they had to like specially design my prosthetic and everything so that I could have some resemblance of normal walking at all. And now I'm at a point where my progress with the prosthetic is kind of plateaued, and I mean, I'm nervous for sure to have a second surgery, but that's what my doctor's suggesting at this point, as well as the prosthetist. They pretty much said like there's not a whole lot they can do to keep away from this super crazy sensitive nerve. And yeah, my pain has still been pretty intense since the amputation. Most of you know that if you've been following along for the last little while. But I'm still scared to have a second surgery in the same area that I had CRPS. I think mentally it's been an up and down week for me too, because there's been a lot of storms. So obviously with any surgery, there's going to be some risk. And fortunately, there is another amputee that had a similar situation to me, that had had CRPS and amputated, and the doctor said this was just the first patient that they did with CRPS, and the amputation was performed by someone else. But basically what happened is they formed a neuroma, which is kind of like a grouping of little like nerve endings right on the end of a severed nerve, and it just hurts like crazy and cause all sorts of issues with trying to fit a prosthetic. And so they think that's what's going on with me, is that I have a neuroma. They think that that's what's causing all of the sensitivity right in the area. I mean, like bone issues, yeah, sure, there's some soreness around the tibia, which is right there. So I mean, like especially right around the scar and the bone, there's some soreness, but fortunately most prosthetics can work around that issue to give you a more comfortable fit and a more comfortable way to walk, hopefully. So that's kind of where things are at this week with everything. We had a couple of days of really nice weather this week though, where I actually went outside and worked on my laptop. I even got sunburned on my arms a little bit, like back on Monday, and so that was kind of funny. I was like, yeah, I'm totally intelligent. It's spring and the sun is like directly on me. I'm not gonna get burned. But I did. I got fried. So